join me in welcoming Maria James.
Good afternoon. When my oldest was diagnosed, I knew that I needed to educate myself about autism and effective treatments for autism. Our pediatric neurologist strongly recommended that we find an intensive therapy program of at least 30 hours a week. I wanted to share my experiences with those who make those legislative decisions, because I think that there's different types of therapy out there, and I really believe that ABA is very effective in improving a child's future. So I wanted them to know that not all programs are equal. I realized that I needed to make some critically important decisions. However, I still felt that at that time I did not know enough about autism and effective treatments to make the right decision for my family.
Rosie was 1 year old when we started to see some differences in her behavior, a lot of zoning out, where she would just be off in a distance. You couldn't get her attention.
When we found out that Rose was diagnosed with autism, we really didn't know what to expect. Initially, you're kind of in shock in the beginning, because you don't know, what is this? I mean, what's going to happen? It's a scramble to try to find out what the best course of action is.
Here we are at Candy Castle, but how do we get in? Use the broomstick, says the cat. We ended up with a pediatric neurologist in Boston, and it was that neurologist that kind of pointed us in the right direction. And she basically, taught us about intensive therapy programs and gave us several references. And it was all just different therapists, and some of the people on the list were also parents. I actually felt more comfortable taking advice from other parents than, therapists.
It's not like going to a used car lot and you have a choice of 100 cars. I mean, it's very, very limited as to what's available out there for you.
I spoke to several other moms who were kind enough to share their personal experiences with me. From these conversations, I noted that at the heart of their intensive therapy programs was ABA. We kept going to seminars and trying to educate ourselves about the different types of therapy that were out there. And I just felt that every time I left one of those seminars, I didn't have a comfort about the substance behind the therapy. Everything was about their emotions and their feelings, and everything about ABA was just more scientific. After hours and hours of research and several phone conversations, I knew that I needed to find qualified ABA therapists in Rhode Island.
We had heard kind of through in the autism community that Perspectives had the best ABA program.
This is a little girl we've been working with for about a year and a half, and she already had some basic language.
Initially we met with Bob Kidd, and he told us about the program, and he explained to us how intensive the program is, and pretty much told us that you need to really be committed to the program in order for it to work. That it wasn't going to be easy. What they try to do in the program is to shape Rosie's behaviors, and at the time she had very limited communication skills. She would spend most of her time by herself, rocking on her head. He explained the program to us as they would change that behavior and try to make her free time more functional.
I have block. He has ball.
The goal was to get Rosie verbal so she would be able to communicate her needs to us, which reduced her frustration level greatly.
Nice job. Very good.
I mean, just imagine not being able to tell someone what you want or what you need.
I met Bob Kidd from Perspectives. He came to the house, him and his laptop, and he showed me a video of a child in the program. It was very, hands-on. This is what a session is like. This is what we do. This is, what we'd be working on first, and then this is how it evolves. So I got to watch how this child progressed from being totally non-compliant and totally nonverbal to actually speaking, and totally changing by the end of the video. Her demeanor was just so different. She seemed so happy by the end of it because, you know, she had a skill set. She could communicate. The frustration was you know, a lot less at the end of the video than it was at the beginning. So when my husband and I both saw that video, we said to ourselves, that's what we want.
Rosie has a staff of 4 therapists right now that come to the house 5 days a week. And she has 2 shifts per day, so that's 6 hours a day that they're here in the house. And we meet once a month to go over the programs and to make sure that we're heading in the right direction with her programs.
But there will be a clear contrast between that and tabletop activities.
It is a lot of work. It's a total family commitment. The kids both have 40-hour therapy weeks, which is a lot. Every time I say that, people look like I'm torturing them, but I'm not. They enjoy it. It's funny to me, but they realize that they're learning how to play, how to interact, how to have fun. So it's not therapy for them. It's all that they know, but they enjoy it. I'll never forget the day I came home from work and I came in and I heard Amelia saying, "Michael, chase me." And I was just like, oh my God, I got to get there and watch this, because I had never seen her ask him to play with her, and that was that moment. And I was just so happy that I had come home from work and enough time to see it. I think it's really difficult to describe what Rosie's delays really are, like how delayed she is, or was, I should say.
Good job. Touch spaghetti. Excellent.
Like to say that she didn't know who I was. And then the day that she pointed and said, "Mom," and then turned her head towards me. I think everybody in the room cried. So we have a lot of moments like that, because a lot of people that are here now have been with Rosie since the beginning, and they see where she was and where she is today.
She went from being nonverbal to sitting down and reading a book. And most people probably don't understand all the stuff that's in the middle, what it takes to get a child from not being able to speak to sitting down and reading a book. I mean, it's unbelievable.
I am thankful to the leaders of the state of Rhode Island who have supported such programs with funding so that children like mine can be offered effective treatment to help them reach their fullest potential. If it weren't for the Katie Beckett Medical Assistance Program, Amelia and Michael would not have access to this medically necessary treatment.
Who is it good to see you today?
We hear about other states where it's not an option. They don't have any state-funded programs, that only people that are wealthy are able to have these type of programs for their kids. So it's incredible. It's incredible that, you know, we were able to do this.
The fact that Rhode Island invests in their children is important, and it is logical, because if they didn't have it, you know, my children wouldn't have a chance. If we did nothing at the beginning, we'd be taking care of them at the end. They're taking a very proactive approach, and that makes sense. To me, ABA is not a therapy session. It is a mindset. I view every moment with my children as a teaching opportunity to develop relationships, communication, play, self-care, and to participate in family and community activities. So it's quite surprising to me that the therapy that I was told was ignoring their emotional life totally has given me gifts of, you know, normal family interactions and emotions and just joy.
The parents out there looking at different options for treatment. For us, ABA has worked. Perspectives has done a great job with Rose, and you know, how do you thank someone for giving your child the ability to speak? Because sometimes it's not the words aren't there.